So hello everyone again. So we have as you must have seen the posting on RVLE, we have a guest speaker from Europe. You must have read her bio, so I'm not going to spend so much time in talking about that. Just know that she's a dentist by profession and uh, very well recognized in her field and also on social media. She's well known in her country and globally speaking. And we wanted to understand that change management, yes, it impacts uh, the business management and so on, the type of courses which we do, generally speaking, in our undergrad, coming from social sciences, this business related background. But I thought that let's take someone who is maybe not from the field where we are, and try to have an understanding that how change management happens in their field, what they do, and maybe we can learn something, so all of us can appreciate wider applicability of what we have been doing. So I reached out to Dr. Anna, and she was very kind to spend to give us time. Please appreciate that there is time difference, so it is late in the night for her, so she took out a time for her, for which we are very thankful. She's also very fond of Jamaica, and most likely she's going to visit us. So I hope that you will reach out to her, make friends, and share thoughts and idea. She's very easy to talk, just like you guys are. So don't be shy. I have given her Instagram link without even asking her on RVL. So I hope she does not mind, and reach out to her and make connection. Networking. Brandon was talking about it. So now is our time to network in Europe. But anyways, please give warm welcome to Dr. Anna. And after the presentation, try to ask question. Let's see how we can learn. So thank you very much, Dr. Anna. Once again, welcome to our room. We just have 15 participants right now because the semester is ending and people are thinking about preparing for final exam. But please be
Yeah,
rest
sure.
assured that these 15 people you have, they are really interested in anything you would have to say. So they are not here because they have to, they are here because they want to. So over to you, Dr. Anna. Thank you very much.
Thank you. Thank you for your kind words. Okay. As you told your students, I'm a dentist, and normally I speak to my patients or to young dentists who are still studying. So you guys are like a new niche for me, new audience, and if you won't understand anything that I'm saying, please ask me, because it's not obvious for me what you're understanding or what you're not, because it's like everything I will be talking about is like my regular day and routine and everything what is happening about my job. Okay. I have to come up with some title, and I think that Will Dentistry Ever Look the Same is like very accurate title, because of the change you're talking about almost every meeting, and also because it's COVID-19, right? Okay. Whoa, too much. Okay. Who am I? I think that everyone sees me a little bit different, and I think I'm few person in one. But some of people know me as a doctor. Most of people know me as from my Instagram account. So my name is Anna, and I'm 26 years old. I am a dentist professionally, and that's what I do for like 10 hours a day. So the biggest part of me is a dentist. I'm also an aesthetic medicine doctor because I like to combine techniques that gives people function, I mean dentures, and also the aesthetic. It's combined and you cannot separate one from each other. Also, I'm young, blonde, and a woman. And why is it important? Because people people underestimate me. People think that I'm too young to know something. I'm too young to say how dentistry should look like. It happens to me that patients are who didn't know me walking into my office and ask when the doctor will come. That's always funny, and I'm just like, "Hi, hello, I'm Anna. I'm your doctor today." And they are like, getting red and blushed. So that's my everyday life. Also, I'm a lecturer, but I'm giving lectures for young dentists who are still studying, because I believe that what they are taught at school, it's not like up to date. The knowledge is old, and the methods they are teaching students are old, and dentistry should look completely different from what they are showing to the students. And also, I'm a social media influencer, but I don't like to call myself influencer in a way like a celebrity, like online celebrity or something like that, these Instagram influencers. I mean that I always wanted to make a change, to push people to, perform better and develop their skills. So I am very open to say to people through my social media how dentistry should like, what a good dentist look like, how he or she should act, what kind of machine she or he should have in her office, what methods, and so on and so on. And I believe that that will raise the knowledge in the patients generally in Poland. And if they will be looking for a dentist, they will be looking for a good one, for a modern one. And if they have like an old dentist who is using old methods, they would say, why you are not using new methods? That method is bad. And it's happening right now, and I believe that I can change a little bit dentistry in Poland, because as I told you, the knowledge we are taught during our studies is like 40 years ago knowledge. The newest books are from 40 years ago, so imagine that. All the new knowledge, all the new skills we are learning after our studies, and we have to pay a lot for this. But if we want to do really good dentistry, we had to do it. It's obligatory. Everything in our industry is changing, but we don't know the outcome yet. We have a lot of dentists around the world, not only in Poland, who are very open-minded, who are like visionaries. And I think that they are prepared for change, maybe not for the outcome. Maybe we don't know what it's going to be like in 1 or 2 years, but they are flexible. They can adjust to the situation, and we all should be like that. But also, some of the dentists are scared, and they close their practice, and they just thinking about maybe changing the occupation. And I think that that's not a good that's not a good way to survive through this pandemic situation. We have to be, more flexible. Can dentists work from home? And I think most of you just thought, no, it's impossible. We just have to see our patients. Of course, we cannot treat patients from home, and we cannot see patients for our consultation, but we had to do something so we can give advices and tips. And in the beginning of this pandemic, it was like second week of quarantine. I just come up with the idea to shoot a video with basic tips and advices for the patients, how to manage the basic, let's say, dentistry emergency at home with the usage of available drugs and everything they can buy by themselves. Also, I gave them some advices what they shouldn't be doing at all, or what kind of situations they need to go to the dentist ASAP. And I think that I gave them really good, like, I don't know the word. Okay, that doesn't matter. They were calm. They just knew what to do without, seeing the dentist, or just wait for the dentist practitioner to open their practitioner. I share the knowledge, and I think it's all very important, because with the knowledge we become more calm. We know what kind of situation is a bad one and we have to worry, and what situations are like, okay, I can live with that, we can treat it later. We became more available. I mean, normally we work a lot, like dentists in Poland, we work a lot, we are workaholics. I think that's proven. And we don't have time for our families, and not even thinking about writing to patients or calling them. But now we have more time, and we can take care of our patients, like through I don't know, emails or phones, and connect with them to feel them taken care of without seeing them, of course, and give side view. I think that is very important, because patients, they don't know what is happening inside our practice. They don't know what is happening when they are out between the patients, and what we have to do to make our practices a safe place for them. And if we want to have a good connection with our patients, we should show them. It's not a secret. We should show that we buy a lot of protective things and disinfection and so on. These things were always in our practice, but now we use it even more. So we have to make our patients feel safe when they come to us. Can dentists learn and practice at home? Of course, now webinars from all over the world, and it's a free knowledge. It's really great. I don't remember when I learned so much, like from for the last 1 month. I watched the doctors from all over the world, from United States, from Sydney, and it was so many webinars that I was sitting on two in the same time and watching them simultaneously. So it's time for sharing, it's time for learning, and we can also practice on phantoms. And we have like a lot of time to do this, so we can become more skilled and more developed our skills. And also it's time to make decisions, and that's the tough one, because I don't have my own practice. I work for practice, and I saw how the owners were acting, how they reacted this pandemic, what decision they were making, and it made me think, who is only the owner and who is the boss, with whom I want to work in a long period of time, who will have like a good teamwork and take care of the employee. Ooh, I'm back. Rapid development of digital dentistry. Digital dentistry started like 10 years ago, but now I think, well, back in the days, it was like only very fancy and modern clinics were using digital dentistry because it was, of course, expensive. But now, when we have COVID, it's like a necessary thing, because with the digital dentistry, we can share the files without sending, for example, impressions with the bacteria from the mouth. All the data we can send from the clouds very fast to my technicians. I work with the technicians on Costa Rica, Sao Paulo, from Spain, and so on, and we just connect like that. We just sending the files and speaking when we need to speak. It's an international cooperation, and I think it's great. It's amazing. When I was studying dentistry, I wouldn't think that dentistry is so much about digital and computers. In fact, I thought I was just treating patients. Okay, here are some digital things in my practice, which I'm using almost every day. The first one is intraoral scanner. It's a scanner for teeth, in fact. It's something we use instead of making impressions, and it lasts like 3 minutes to take a scan and just one click to send it everywhere you want. The second thing is 3D printer, and if you want to print the model, I just push the button and the models are printing. And the third one is it's new kind of orthodontic treatment. This is aligners. And aligners are like orthodontic appliance, but without any hard metal parts. And also we are printing it, and we are the whole process of orthodontic treatment is planned digitally on my computer at my home whenever I want to open a patient case and just send it to print. And all the orthodontic treatments for 6 or 12 months are just printing in one day, and just they send it to me in 1 week. So that's very fast. That's what I mean. One day dentistry. It's something that is very safe and efficient right now, because it helps us to do everything like chairside. We say it's chairside dentistry. It means that the patient comes to me and I'm doing all the prosthetic things like crowns, bridges, veneers, like right away. I scan them, I let them go drink coffee and read some magazine for an hour, and then I am printing it, and they come back to my office, and I'm just, giving them their new teeth in 1 day. And it's very safe right now, because we don't have to take 10 patients a day, just take one and do everything right away. And the patient don't need to, come to my office many times, so it's less visit and shortage of the whole treatment process. I am happy, the patient is happy, and everyone is safe. Dental technician, I mean more like digital dental technician, because this is completely new occupation, because they don't work on models. It's not a physical job as it used to be. They just work with their computers. They just making 3D projects, and also click the button and just print everything they process on their computers. So they work from everywhere. They can, you know, go to Thailand for vacation and still work. They just need the computer. So it's a really good job and completely different from what we used to think about dental technician. Online consultations. They are now, like, we are trying this kind of communication with our patients, I mean new patients, because we don't know if it works for a long period of time, but now we see the interest in the patients. We made like instructions video. The patient can download the app with the face scan, so they can scan their face at home. They can do the photos and send it to us. It's like an initial selection of the patient we want to work with, because if they do all of these things, it means they are really, and they want to do this. They put some effort into our cooperation, let's say, because I don't think about treating like it's my job. It's also patient job to, you know, get to the appointments and to take care of their teeth and listen to me, generally speaking. So no more distance problem. And if the patient just decide to do the whole treatment, they already know what we are going to do, how much it will cost, and then they decide to just come and see me. More time for one appointment and additional time between patients. That's how our work now looks like. Because work organization change, we have longer appointments, because as I told you, we want to do everything in one appointment. But we have to do some additional time to clean the office, to, you know, open the windows and clean everything, even floors and walls and so on. So we need like additional half to 1 hour. So maybe it's a lower profit for us, but not necessary, because we do big works, the whole change in a smile. Not just, it's not a dentistry on of a one tooth, it's just whole change of a patient. Bigger costs for private practice owners, of course, because there is a rise of material costs. Everything costs more. We have to use more disposable items, so also the costs are higher, and additional protective items. But I think that's the thing that we all have to do. Not only doctors, we can see it in the shops and all of the in all of kinds of industries, also food industry, and so that's not unique for us. So dental procedures became more expensive. Yes, I think they will, but it also gives us opportunity to do big jobs. I mean, to change the whole smile, the whole function of a teeth. Because if we do just one teeth, we can have some problems later. I don't want to get into this, because that's the medical stuff. I don't want to bore you, but that's the truth. Just remember about it. Will we get to choose the patients? I think we will get to choose our patient, because I think that we don't want to see emergency patients. Why? Because they are not good patients. We have some good and bad patients. And bad patients is the patient in pain, and he wants to be admitted right now. He don't want to pay because he's in pain. And when we help them, they don't show for the next appointment, so we can't, you know, close the case and end the treatment. So of course they will come with the pain later again, and I don't see point in treating patients like that. So we do the full treatment plan patients, and we only want to see this kind of patient because with this kind of patients, I am certain that when I end the treatment plan, they will be completely healthy. Then they won't come back with the pain, and they will just see me from the for 1 in 6 months just to check if everything is okay. And that also connects with the cosmetic patients, because full treatment doesn't mean it should be like aesthetic full treatment. Sometimes full treatment is just for function, but also, by the way, we do the cosmetic because that's just, we are changing the tooth, so why doesn't it change the appearance, the look? What is more important, cheap dentist or safe dentist? That's the question that every patient will have to answer, because I think that the safe dentist is more important, and I also want to work with the patients that thinks that safe is the most important, not that they want to spend as little as possible, because I want to give them really high performance treatment, not cheap and fast treatment. So a patient will come to me and say, like, okay, he's with the pain, and I'm saying, okay, you need the root canal treatment, and it costs that much. And the patient is asking me, can we do it cheaper? And I'm saying, yes, of course. Maybe I want to use anesthetic. That will be cheaper. And they just understand that I want to give them the best, all of material and techniques that I can use to make the treatment really good. And we cannot design from anything, because that's not the price is connected with the quality of the treatment. Okay, thank you. If you have any questions, I'm more than happy to answer.
Yeah, hello.
Hello.
Hello. Yeah, I have a question.
Okay.
By the way, my name is Matthew. Nice to meet you.
Nice to meet you, Matthew.
As it pertains to the digital dentistry side of it, you have some patients that prefer having to meet their doctors one-on-one, face-to-face. Some are more comfortable that way, so that way they can properly maybe communicate their issue. Do you think that with the change of COVID and online dentistry, do you feel like you have changed as a person to kind of facilitate the needs of allowing someone to feel comfortable online rather than them being in the office? If you get what I'm trying to say, like, have you been able to adapt to getting results out of a person, or allowing them to properly tell them what they're feeling online rather than being in the office itself, where they probably feel a little bit more secure knowing that they have the tools, they have the tools there at that moment to treat them, rather than them just looking at you through a screen and just wondering if she will actually be able to help me properly.
Yeah.
If you understand what I'm saying, that's what I
know
want
what
to
you mean.
adapt it in that way.
Yeah, I know what you mean. Well, first of all, I am using my social media for a long time, so some of my patients get to know me from my social media and then come to my office. And I think they wouldn't come normally because they just know me as a person. I am on social media, and when they come, also they get to know me as a doctor. But what you were asking, if they won't be sure if I can solve their problems. Of course, we don't treat patients online. We cannot do this, it's not professional, but we can ask as many questions as we can and just tell them what we are going to do to get to know the solution. So we don't give them the solution. We don't say, I will treat you and I'm the best dentist, just come to me and give me your money and I will, you know, I will make your teeth shine. No, it's not like that. Of course. Also, it's very often that patients write to me that they have a treatment and the tooth just broke and what they can do. And I'm always writing like, I cannot help you without seeing you, like in my office. I don't need your photo of the tooth because I need your radiographs and I need to, you know, to check it, to see it, to use a microscope. But as I am telling them about this, they get to feel more confident about that I am the person who knows how to check the problem. Maybe I won't solve it. Maybe I just give them to some of my older colleagues who are better, because I never do things that I'm not sure of. But I think they get the feeling that I can work with them, check everything, and make sure I will help them or I will find someone who will help them. And I think that's about it. Not treating online. No. That's a bad practice.
Yes, and in your presentation, thanks again very much for your presentation. We learned so many things, and you were able to relate with what we have been discussing in various points in our semester. For example, when you said that times have changed, yes, times have changed, but you spoke about online consultation, and then you said that you guys can give tips online. You can share your knowledge, so even from home you can do that. So for us as business management students, we also need to think about these things. That yes, maybe we won't be able to find jobs in the corporate world the way we were able to before COVID-19. Going forward, there are things which we can do, as you very nicely explained that how times have changed. And thanks very much for bringing that point ahead. Another thing which you mentioned, and we really learn from that, is rapid development in your field. And we know that from our own readings also, that be it manufacturing, any type of business, manufacturing any type of services, every field is going through rapid development. Technology, you spoke about big amount of data. So I would want to highlight here that any jobs related with data, they are going to be in high demand going forward. So earlier we were talking about doing some short courses when Renisha was conducting her discussion. So she mentioned doing short courses. So any course which is about data analytics, data security, mining data, those type of things are something which are going to be used across industry, be it business, be it dentistry, medicine. See the big difference, but it's across the usabilities across our doctor mentioned use of scanners. Yeah, she mentioned use of new technologies, where she spoke about 3D printing. So anything, any knowledge, any skill which we can gain in terms of using 3D printers or anything on that, that is something which is useful. You guys can run your search. So doctor spoke about making the fixtures using 3D printer, but people are using 3D printer to do anything. Let me tell you that people are using 3D printers to print food which is eatable, not food which is just for decoration. You can eat that food. Just run a simple Google search or go on YouTube and just mention that uh, uh, just write 3D printing food. You will be amazed what is. So sky is the limit in that field also. uh, our doctor mentioned something about dental technicians, and she mentioned that all they need is a laptop, and they can have vacation in Thailand or Jamaica or wherever they want, and they can work from that. So you need to be very very open to these changes, especially in the context where doctor is talking about post COVID. Things are even going to change even more, so you need to think about that. couple of questions, but please guys, you think of your questions, and we would want to maximize from doctors valuable time, and maybe you can ask a couple of questions. I would like to ask a couple of them, just to facilitate the movement of the discussion. So doctor, I want to really ask that, people come to you and they say, okay, my teeth is a little bit flawed, and my smile is not as beautiful as I want, and because they are looking themselves in the mirror more often, and they are more critical of themselves. So maybe someone would say, oh, Tashfin is very handsome, or Dr. Anna is very beautiful, but the way we look at ourselves, we know, we need a little fixing here and fixing there. So my question is that when people come to do, this is a change, and this is a big change in it changes all of your structure of your face. So people really need that change, or is it something else which they don't really need it? They are. So what is the underlying cause of going through that change? Because this is a big change. So when people are coming to you and asking you that fix this and fix that, how often is it that you as a doctor know or think that, oh, this is not needed, she's fine, he's fine, or something like that? So anything you can say on that change, and do people really need that change? What are their psychological things which is going, when people say things, how they influence their thinking, how they start viewing themselves? Anything on that, if you can spend some time talking about that. Thank you very much, doctor.
Sure. Well, that is very interesting subject, because well, we can make two groups of patients. One is the patient with the pain, as I told you. But let's say it's a patient who also wants to solve more problems. He's aware that there are some problems with his teeth, but he don't know exactly. But the one teeth is in pain. So they came to me and say, okay, you are a very good doctor. I saw your work. I have this problem, but maybe you will find something else. And there is always something else, because it's not that simple that only one tooth is ill, right? And these patients are more, as I like to say, functional patients, because all of my patients are interviewed by me before I even start one appointment with the treatment. The first appointment is just talking, taking pictures, and interviewing them. And of course, the first question is, what do you think about your smile? And that's a very opening question. And now I get to know them, not as a patient, but as a person. Of course, the answers are really different sometimes, and sometimes even shocking. Also, there are some patients that don't want to answer, but it's really hard for me then to think about designing the new smile if I don't know what is the best, the worst thing they think it is, right? Because as a dentist, I see, but I can see that the biggest problem is, for example, missing molar for me, because that's the function. And for patient, maybe the dark color of his incisor, right? For me, it's not a problem at all. It's just the cosmetic. So you were asking why they are doing this. The most common answer, I think, is the wedding of their children. It's like 50-year-old patient, and she's going, for example, to USA for her daughter wedding, and she's saying to me we do the Hollywood smile. I'm going to US for my daughter wedding. Let's go. Let's get crazy. I want the bleach, and I want to, smile like a star. That's one kind of patient, but in Poland, it's not really common. It's more like United States kind of patient, as I like to say. In Europe, we are more conservative. We like to do really natural works, teeth which looks like almost natural, but a little bit brighter, as patients like to say. Brighter, not white. That's the answer almost 90% of the time. Also, it is very common to change the smile when they change the wife or husband. So after divorce, it's like, okay, we are getting new teeth because I want to know my second wife. And so it's really connected to the changes in their lives, in their personal lives. Not just that I don't like my smile. Okay, they didn't like their smile their whole life, but why now? Why now they are coming? Why now they want to spend a lot of money and spend a lot of hours in my office and do the change, right? So I think that it's really connected with the personal life, with the personal needs and with the need of a partner. Also, I have patients like 30-year-old man without a wife, without a girlfriend. He has a lot of money. He's like, you know, riding a new Mercedes. He's earning a lot. He's a businessman, but he doesn't have a girlfriend, and that's his biggest problem in life. And he just thought that if he changed his teeth, his smile, he will be more confident, so he will find the wife, right? That's really like getting into psychology of the patient. But the funny thing is that some of the patients are really closed and they don't want to speak open about their problems. And it's like, I need them to smile. I need them to smile. Without the smile, I cannot make any project, because I need to see the lines of the lips and how the muscles are working. As I told you, the face aesthetic is really connected to the teeth. And I am taking a photo and saying, please smile. And they are doing something like, and okay, but with the teeth, please. How can I think about your new teeth when you're not showing me your present one? And they are saying, I'm not smiling with my teeth. Okay, so my work is done. I cannot do anything about it. Please just put some effort in this. So I need the patient to cooperate, and I need to them to want the same as I want.
Thanks very much, doctor, for explaining that, and really took a couple of very interesting points, and I hope cohort also took some points, because you spoke about a couple of things. For example, confidence. So where do we derive our confidence? Is it from our looks? Is it from our knowledge? Is it from our brain, from skills? But definitely looks are important, especially because we live in a society where people judge us from the looks. Just like doctor mentioned that she told us our age, she told us things about her, so people would come and judge her that, oh, she would not know anything. And we know that there are so many jokes about blondes also, so we need to think about that. Yeah, so yeah, not that she has great knowledge over there, but people have their perception, just like, you know, just like Indians, people have their perceptions about Indians, just like black people have their perception. So that is interesting talk. One more question I would want to ask, and after that, if there are some people who want to ask some questions, please raise your hand, because we are slowly coming to the closure of this item on the agenda. So my last question is Dr. Anna, is that you spoke about new technologies, and we are very much interested in using new technologies in our fields also, whatever we do. So I'm interested in understanding that when you are using any type of new technology, these people you have around, even yourself, what is the level of resistance? Because you have your own way of doing things, you have your own equipment, and then new technology comes. So of course you would have to learn and everything. You have to get used to that. in that, generally speaking, people like to do things the way they have been doing. They are not comfortable in learning new things. But definitely they have to hone their skills, especially in dentistry, because new things are coming. So what we want to understand that what is the resistance which comes in the way of learning new techniques, learning new technologies, and what are some of the things you might have seen or you might have used, or you can maybe tell us that whenever you face resistance, these are the things which you can use to minimize that resistance. Anything you can say on that, we would be very thankful. Thank you very much.
Okay. Well, first thing is that I don't work in the places with the resistance, as you said, as you call it. And the other doctors I'm working with, we are working like a team. So it's not like I'm doing, for example, orthodontics and all the other doctor is doing orthodontics with other methods. No, everyone has its own field, and we are the one patient go through all of us. Okay, so it's like teamwork. But the resistance is almost always with the dental assistants. They are less knowledge than we are, but they are always scared when we bring something new to the clinic, some new I don't know, scanner. For example, 2 months ago we bought the second scanner, 3D scanner, so now we have two in one clinic, and the other one, the second one was even easier to use, but none of them want to touch them. So I try to be really really like open for them and understand that they are scared, and I explain to them how it works, how they should do the scan, and I'm sitting with them and checking if they're doing a good job and giving them a lot of compliment, like, you are doing great, as you can see, it's not that hard. Okay, let's do it. But that's the person that I am working with, so I have to do this, even if I think that it's really simple and they can learn it all by themselves. But I want my team to just work with me, using the same techniques as me and the same things as me. But the other resistance is like from the outside, from the other doctors in let's say in Poland, because as I am showing to the whole, let's say, even world through my social media how I am working, what I am using. Some of the doctors are like really rude and writing to me like, "Oh, don't show it to the patient. They will come to me and they want the same. I won't give them that. It's not useful. It's just some bullshit." Sorry for that, but that's the truth. And they are like trying to scare me, and they can even be offensive, really offensive. And in the first moment, I was like, oh my God, maybe I shouldn't really show them, because I don't want to be judged. As you say, it's not nice for everyone. But then I thought, okay, that's the change that I wanted. Maybe they are angry because they cannot learn, or they are scared, but they're even more. They work longer as a dentist than I am, but they know less, so they can get angry, right? So let them be angry, but maybe they will change something or just quit their jobs. I don't care. I don't want that kind of dentist in my field. So let them choose.
Thanks very much for great presentation, and thank you very much for staying here to answer our questions and help us understand change management. We know that you had a long busy day at office and you made time for us. I'm really thankful for the time you took, and guys, I want to tell you that Dr. she's an expensive doctor and she charged a lot for her dentist jobs, but she did not charge us anything. She was very generous and she said that okay, no problem, she's available, and we are really thankful for all the knowledge shared. And I hope you guys will reach out to her, keep connected, and because you must have seen that it is not just the knowledge as a human being also. She's also very generous, as you could see in her presentation. So thank you very much. Doctor, I hope you can see in the comments, people have said thanks to you. I think Renisha want to say something, and with that we are going to make the closure of your of our engagement. Yes, Renisha, please go ahead.
Good afternoon, Dr. Anna. I would like to say thank you for coming and speaking to us about the changes you've experienced in your field as a result of COVID-19. We really appreciate that you took the time to come and speak to us today. So thank you, and we really appreciate it.
Yes, Michaela, please go ahead.
Hello, good afternoon where we are right now. I would just like to know, differently from Instagram, are there any other networking things, any other things you've done to network to gain more clientele?
Well, I am using also YouTube and LinkedIn and all of the platforms that I can use. I also write some articles on Medium and make some podcasts on Spotify. But I don't do it for just get clients or patients, because I really, believe me, I have really full hands of work, and it was never my purpose to get patients through this. I wanted to educate patients. I wanted to be aware, because I know that in Poland, generally speaking, the average knowledge of a person, or about their health, their teeth, even how they should clean their teeth, is very low. Sometimes it scares me. Like, patients are saying that they are not brushing their teeth at all, and they come with the suit to my office. So that always, like, how it's even possible. So I know it's really it's something really precious, and people need it, because in the school no one teaches them that. So where they can learn it? No one is teaching it. So I need to give them the knowledge as a specialist. I don't care if they come to me, to my dental office, or they will look for the dentist who is also as skilled and knowledgeable and just smart. There is a lot of dentists like that, but people don't know about it, because they are not in social media. How they can find them? They exist. Some of the people are writing to me like, there are no doctors like me, with the compassion, with the caring, with the new technologies. It's impossible. And I'm saying, no, I know a lot of doctors who treat like me, who are taking care of their patients. They are my colleagues. So just look for them, but people don't know where to look for them. I need to connect those words. That's the feeling that I have inside me.
On my side, so thank you again, once again, Dr. Anna. Really appreciate it, and we learned a lot. Thank you very much. Appreciate it, Dr. Anna.
Thank you. In Jamaica, I hope.
Definitely. So you have at least 15 people. You have these acquaintances, and please let us know whenever you visit Jamaica. These friends in the cohort, they are spread all over the island. So I'm sure
Great.
they would love
I
to
would
meet.
definitely go for some food. I am a food maniac. I like to taste every food in the world. So, well, when I visit Jamaica, just, well, we grab some beer and go eat for sure.
Beautiful, beautiful. And let me tell you that our slogan is out of many, one. So all different type of people of different races, different colors, you will find in Jamaica. And when you will visit us, you are really going to love the country. And please, when you are visiting, don't pay a lot of attention to the stories about Jamaica. Many times on the media, they say there is so much crime, this and that. It is just as much crime as anywhere else in the world. You just, wherever you go, you just have to be watchful and you have to be careful, just like in any other country. But please do. It is a beautiful country, a land of wood, water, beautiful country. You are going to love it. People are very welcoming. So definitely we are going to keep in touch also. And thank you once again. Appreciate it. Yes, doctor.
Thank you. Bye, guys.